Mole Psychiatry. 2024 June 7th. doi 10.1038/S41380-024-02601. W. Online ahead of print. Abstract. Anorexia nervosa, AN, is a complex metabolic and psychological disorder that is influenced by both heritable genetic components and environmental factors. Exposure to various environmental influences can lead to epigenetically induced changes in gene expression. Epigenetic research is still in its infancy, and studies to date are limited in determining clear, valid links to disease onset and progression are limited. Therefore, the aim of this systematic review was to compile and critically evaluate the available results of epigenetic studies specifically in and to provide recommendations for future studies. In accordance with the PRISMA guidelines, a systematic literature search was performed in 3 different databases: PubMed, Embase, and Web of Science, through May 2023. 23 original papers or conference abstracts on epigenetic studies in and were collected. Epigenome-wide association studies, EVASs, which analyze DNA methylation across the genome in patients with and identify potential disease-relevant changes in promoter/regulatory regions of genes, are the most promising for future research. To date, 5 EVASs on and have been published, suggesting a potential reversibility of malnutrition-induced epigenetic changes once patients recover. Hence, determining differential DNA methylation levels could serve as a biomarker for disease status or early diagnosis and might be involved in disease progression or chronification. For future research, EVASs with a larger sample size, longitudinal study design, and uniform methods should be performed to contribute to the understanding of the pathophysiology of AN, the development of individual interventions, and a better prognosis for affected patients. PMID 388495160I 10.1038/S41380-024-02601. W. Document the CPD share evidence. Estimated reading time 5 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Epigenetic alterations in patients with anorexia nervosa, a systematic review. Title: VR-related evidence matrix. iPSC-derived models for anorexia nervosa research. Association of serotonin receptor gene polymorphisms with anorexia nervosa, a systematic review and meta-analysis. Gestational epigenetic age and ADHD symptoms in childhood, a prospective, multi-cohort study. Epigenetic modifications of DNA and RNA in Alzheimer's disease. Epigenetic mechanisms linking early life adversities and mental health. Exploring the epigenetic landscape, the role of 5-hydroxymethylcytosine in neurodevelopmental disorders. Exploring the influence of stress on aggressive behavior and sexual function, role of neuromodulator pathways and epigenetics. Objective, cognitive remediation therapy, CRT, can be used as an adjunct treatment for adolescents with severe and complex anorexia nervosa and requiring inpatient treatment. However, there has been only one study on CRT for adolescents with and in Japan. This study explored group CRT as an adjunct to inpatient treatment for Japanese adolescents with severe and complex and requiring inpatient care. Methods: 31 adolescents with and underwent group CRT. Neuropsychological, set shifting and central coherence, and psychological assessments, motivation, self-esteem, and depressive symptoms were measured before and after the intervention. Weight and symptoms were measured before and after the intervention and at follow-up, and the adolescents completed post-intervention and follow-up questionnaires. Results: set shifting led to medium to large effect size improvements. Medium effect size improvements in central coherence and depressive symptoms were also observed. The feedback from the adolescents was mainly positive, and the treatment completion rate was high. The patients also reported that the skills learned through group CRT could be applied in daily life. Conclusion: group CRT may be beneficial for adolescents with severe and complex and who require inpatient care. PMID 3884930 doi 10.1177/13591045241259255. Document the CPD share evidence. Estimated reading time: 4 minutes. Latest: psychiatryai.com #Razor4D. Cool evidence: engaging young people and students in real-world evidence. Real-time evidence search: psychiatry. AI research. Group cognitive remediation therapy for adolescents with anorexia nervosa: outcomes before, after, and during follow-up in a real-world setting in Japan. Title: VR-related evidence matrix. Intensive cognitive behavioral therapy for adolescents with anorexia nervosa: outcomes before, during, and after the COVID-19 crisis. Examining the impact of a group treatment using cognitive and social cognition remediation for young offenders, the Justice Health NSW School Link Advantage pilot study. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Illness duration and treatment outcome of intensive cognitive behavioral therapy in adolescents with anorexia nervosa. Inpatient treatments for adults with anorexia nervosa, a systematic review of literature. Inpatient treatments for adults with anorexia nervosa, a systematic review of literature. Prevalence and correlates of eating disorder symptoms in adolescents with bipolar I disorder. Thinning of the retinal nerve fiber and choroidal layers in adolescents with anorexia nervosa, a controlled study. New aspects in etiology and treatment of adolescent anorexia nervosa, a postulated biopsychosocial model, and the impact of the COVID-19 pandemic. I can't escape my scars, even if I do get better. A qualitative exploration of how adolescents talk about their self-harm and self-harm scars during cognitive behavioral therapy for depression. Determinants and risk factors for renal damage. Where do patients hospitalized for severe anorexia nervosa stand? A multi-center study. June 6, 2024. Evidence. J. Eat Disorder. 2024 June 5, 12, 172. doi 10.1186/S40337-024-01024W. Abstract. Background. Although renal damage is increasingly reported among the most undernourished patients with anorexia nervosa, and it remains underestimated in current practice and often associated with acute dehydration. The purpose of our study was to evaluate the frequency, the extent, and the risk factors of renal involvement among adolescents and adults hospitalized in specialized units for N. Methods. In this multi-center study, 197 consecutive participants were included, aged 13 to 65, from 11 inpatient eating disorder psychiatric units. Information on the course of N, clinical characteristics, biological data, and medication were collected. Results. At admission, mean BMI was 13.1, plus or minus 1.6 kg/m2 for a mean age of 20.74, plus or minus 6.5 years, and the z-score was 3.6, plus or minus 1.33. 6 participants, 3%, had hyponatremia, 2%, had hypokalemia, and 4.5%, had hypochloremia. The blood urea nitrogen/creatinine ratio was over 20 for 21, 10.6% participants. The mean plasma creatinine was 65.22, plus or minus 12.8 moles/L, and the mean eGFR was 74.74, plus or minus 18.9 mL/min 30. 5 participants, 17.8%, had an eGFR greater than 90 milliliters per minute, 123, 62.4%, from 60 to 90 milliliters per minute, 35, 17.8%, from 45 to 60 milliliters per minute, and 2%, under 45 milliliters per minute. In multivariate analysis, only BMI on admission was a determinant of renal impairment. The lower the BMI, the more severe was the renal impairment. Conclusion. When eGFR is calculated, it highlights renal dysfunction found in severe and requiring hospitalization in specialized units. The severity of undernutrition is an independent associated factor. Kidney functionality tests using eGFR, in addition to creatinine alone, should be part of routine care for patients with and to detect underlying renal dysfunction. PMID 3884017 10.1186/S40337-024-01024W. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Determinants and risk factors for renal damage. Where do patients hospitalized for severe anorexia nervosa stand? A multi-center study. Title. Enhancing Emotional Abilities in Anorexia Nervosa Treatment, a rolling group cognitive remediation and emotional skills training protocol. June 6, 2024. Evidence. Your Eat Disordered Rev 2024 June 4. DOI 10.1002/of.3113. Online ahead of print. Abstract. Introduction. Anorexia nervosa, AN, is characterized by limited remission rates and emotional dimensions are often neglected. Cognitive remediation and emotional skills training, CREST, protocol aims to address cognitive and emotional factors. This study evaluates the feasibility and effectiveness of a modified rolling group CREST protocol in an inpatient setting. Methods: quasi-experimental design evaluated CREST protocol in a rehabilitation program. A total of 116 females diagnosed with and were included, of whom 63 were included in the CREST protocol and 53 in the standard rehabilitation treatment. Various standardized measures were employed to assess psychopathology. Data collection occurred longitudinally, before and after CREST implementation. Results: no significant differences emerged between groups regarding changes in specific eating psychopathology. CREST group exhibited significant improvements in emotion regulation, p equals 0.002, and social skills, p equals 0.014, besides a reduction in alexithymia, p less than 0.001, and cognitive rigidity, p equals 0.013. Empathic features remain stable. Participants reported positive perceptions of the CREST intervention. Discussion: the study highlights the potential benefits of integrating emotional training within multidisciplinary intensive treatment for N. Results emphasize the importance of treatment protocol with more effective and hot cognition-related interventions beyond weight-related psychopathology. Implementing a rolling group CREST protocol in an inpatient setting showed promise in enhancing the emotional abilities of end patients. PMID 388375559 DOI 10.1002/.3113. Document the CPD share evidence. Estimated reading time 4 minutes. Latest psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Enhancing emotional abilities in anorexia nervosa treatment, a rolling group cognitive remediation and emotional skills training protocol. Title: VR-related evidence matrix. Correction to comparing randomized controlled trials of outpatient family-based or inpatient multimodal treatment followed by outpatient care in youth with anorexia nervosa, differences in populations, metrics, and outcomes. Treatment of patients with anorexia nervosa and comorbid post-traumatic stress disorder. Where do we stand? A systematic scoping review. Seeing oneself as an unattractive loser, similar interpretation and memory biases in adolescents with anorexia nervosa and adolescents with depression or anxiety. J. Eat Disorder. 2024 June 3, 12/170. doi 10.1186/S40337-024-01016. W. Abstract. Eating disorders, EDs, are complex, multifaceted conditions that significantly impact quality of life, often co-occur with multiple medical and psychiatric diagnoses, and are associated with a high risk of medical sequelae and mortality. Fortunately, many people recover even after decades of illness, although there are different conceptualizations of recovery and understandings of how recovery is experienced. Differences in these conceptualizations influence categorizations of ED experiences, e.g., long-standing versus short-duration EDs, prognosis, recommended treatment pathways, and research into treatment outcomes. Within recent years, the proposal of a terminal illness stage for a subset of individuals with anorexia nervosa and arguments for the prescription of end-of-life pathways for such individuals has ignited debate. Semantic choices are influential in ED care, and it is critical to consider how conceptualizations of illness and recovery and power dynamics influence outcomes and the ED staging discourse. Conceptually, terminality interrelates with understandings of recovery, efficacy of available treatments, iatrogenic harm, and complex co-occurring diagnoses, as well as the functions of an individual's eating disorder, and the personal and symbolic meanings an individual may hold regarding suffering, self-starvation, death, health, and life. Our authorship represents a wide range of lived and living experiences of EDs, treatment, and recovery, ranging from long-standing and severe EDs that may meet descriptors of a terminal ED. Front Cycle, 2024 May 17, 15:1408695. doi 10.3389/FPSYG.2024.1408695. Ecollection 2024. Abstract. Introduction. Evidence on parental educational level, PL, as a risk factor for eating disorders, EDs, is mixed, and no study has assessed its role in relation to the compliance and outcomes of treatments in EDs. Further, no study differentiated from the educational level of mothers and fathers, nor considered the possible mediation of perfectionism in fostering EDs. Methods. A clinical sample of 242 first-ever admitted inpatients with EDs provided information on PL and completed the following questionnaires: the Eating Disorder Examination Questionnaire, EDQ, and the Frost Multidimensional Perfectionism Scale, FMPS. Clinicians also provided information on the Hamilton Rating Scale for Anxiety, HAM-A, and the Hamilton Rating Scale for Depression, HAM-D, for each participant. Results. Individuals with high PL, whether mothers, fathers, or both parents, showed significantly higher scores on depressive symptoms and lower on parental criticism, were younger, had an earlier age of onset, had fewer years of illness. More were students and employed, and fewer had offspring. Individuals with fathers or both parents with high educational levels suffered more from anorexia nervosa rather than bulimia nervosa, had a longer length of stay during the current hospitalization, had less dietary restraint, and had higher personal standards. Individuals with mothers with high educational levels showed a lower rate of previous substance or alcohol addiction. Personal standards partially mediated the relationship between higher PL and lower dietary restraint. Discussion. PL emerged to be a twofold psychosocial risk factor, being associated with higher depressive symptoms and a longer length of stay, but also with a shorter duration of illness and better scholar and working involvement. Higher PL was related to higher personal standards, but not to global perfectionism. Patterns of eating psychopathology emerged based on the high PL of mothers or fathers. PMID 388278991 PMC, PMC 111401360OI, 10.3389/FPSYG.2024.1408695. Document the CPD share evidence. Estimated reading time, 5 minutes. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Role of parental educational level as psychosocial factor in a sample of inpatients with anorexia nervosa and bulimia nervosa. Title: VR-related evidence matrix. Established and emerging treatments for eating disorders. Attachment, mentalization, emotion dysregulation, and empathy in eating disorders, comparing anorexic and bulimic patients. Attachment, mentalization, emotion dysregulation. Latest, psychiatryai.com #Razor4D. Cool evidence, engaging young people and students in real-world evidence. Real-time evidence search, psychiatry. AI research. Persistent hypomagnesemia in the context of refeeding and supplementation, a case report. Title: VR-related evidence matrix. Sex differences in electrolyte abnormalities indicating refeeding syndrome risk among hospitalized adolescents and young adults with eating disorders. Choosing appropriate nutritional therapy for patients with anorexia nervosa exhibiting liver dysfunction, a case report.